diagnosed with mesothelioma, the first question you have is usually, can it be treated? The second question is, do the treatments actually work? The answer to both of these questions, it's complicated. Mesothelioma isn't curable, but the right treatments delivered at the right time can significantly extend life, improve quality of life, and in rare cases, lead to long-term survival that looks a lot like a cure. Today, I want to give you real evidence-based information about what mesothelioma treatments can actually accomplish. Hi, I'm Terry Oppenheimer, and I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice, but I am going to walk you through what the data actually shows about treatment success rates. Let's start with what success actually means in mesothelioma treatment. For most cancers, we talk about 5-year survival rates and cure rates. For mesothelioma, the conversation isn't quite as forward-thinking or clear-cut. We do know that without treatment, median survival from diagnosis on is only 6 to 12 months. That means when we talk about treatments working, we're pretty much talking about extending survival from months to years, managing symptoms to improve quality of life, and giving patients a bit more meaningful time with their families. So let's look at the major treatment options and what the data shows about their effectiveness. First, surgery combined with heated chemotherapy, specifically cytoreductive surgery with HIPEC for peritoneal mesothelioma, has shown the most dramatic results. Multiple studies have shown median survival times of 4 to 5 years with this approach. Some studies report even better outcomes, and one study of 29 peritoneal mesothelioma patients who underwent cytoreductive surgery with HIPEC found that almost 75% of them lived longer than 5 years. A 5-year survival rate of 75% in a cancer that used to kill patients within months, it's pretty impressive. Does this work for everyone? No. You have to be healthy enough for major surgery. The cancer has to be confined to the abdominal cavity, and the surgeon has to be able to remove all or nearly all visible tumors. But for patients who meet these criteria, this treatment demonstrably works, and it works well. For pleural mesothelioma, surgery is a little more controversial. The MARS-2 trial compared patients who'd had surgery plus chemotherapy to patients who'd had chemotherapy alone. It actually found that chemotherapy alone resulted in longer median survival, nearly 25 months compared to about 19 months with surgery. That doesn't mean surgery never helps. It does mean we need to be much more selective about which patients are offered surgery. The patients who seem to benefit most from surgery for pleural mesothelioma are those with early-stage epithelioid disease who are treated at specialized centers with low complication rates. Even then, surgery is part of a multimodal approach, not a standalone treatment. Now, before I move on to other treatments that can help, I want to take a quick break and ask you to do me a quick favor. If you're finding the information in this video helpful, please hit the like and subscribe buttons below. And if there's a topic you'd like me to address in the future or a question you'd like answered, drop me a note in the comment section below. Also, make sure you watch until the end of this video, because I'm going to be giving you more information about accessing treatment resources. So, if we move on to new treatment innovations, immunotherapy, it's changed the treatment landscape for pleural mesothelioma. The combination of nivolumab and ipilimumab, also known as Opdivo and Yervoy, it's now a standard first-line treatment based on the CheckMate 743 trial results. They showed a median overall survival of 18.1 months with immunotherapy compared to 14.1 months with chemotherapy alone. It's a 4-month improvement, and that's statistically significant. But here's what's important. Some patients respond dramatically to immunotherapy and others don't respond at all. We're still learning how to predict who will benefit most. Patients with non-epithelioid histology, like the sarcomatoid and biphasic types, they showed particularly strong benefits. Some patients on immunotherapy are living years beyond what would have been expected with chemotherapy alone. The combination of pembrolizumab and chemotherapy, which was approved by the FDA in September 2024, that shows even more promise with a 62% response rate. That means 62% of patients saw their tumors shrink. Those are real, measurable improvements in outcomes. Standard chemotherapy with pemetrexed and platinum, that's been the backbone of mesothelioma treatment for years. It works, not in the sense of curing the disease, but in the sense of extending survival and managing symptoms. Studies show median survival of about 12 months with chemotherapy compared to about 9 months without treatment. That might not sound like much, but those 3 additional months, they can be precious time. Chemotherapy also helps manage symptoms. Tumors shrink, fluid accumulation decreases, breathing improves, and pain is diminished. For many patients, chemotherapy significantly improves their quality of life during the time they have left. Radiation therapy for mesothelioma, it's typically used for symptom management rather than as a curative treatment. It can be very effective for controlling pain, especially chest wall pain that comes from tumor growth. It can help manage symptoms in specific areas where tumors are causing problems. Does it extend survival significantly? The data is mixed, but for the specific goal of managing pain and improving quality of life, radiation can definitely work. There are also emerging treatments showing promise. ADI-PEG20 is an arginine depletion therapy that I've discussed in other videos. It's shown patients receiving it with chemotherapy have lived 4 times longer at the 3-year mark compared to chemotherapy alone. Now, it's not fully FDA approved yet, but patients may be able to access it through clinical trials or compassionate use programs. So, the question, do mesothelioma treatments actually work? The answer depends on what you mean by work. Do they cure the disease? In most cases, no. Are there cases where patients achieve long-term survival that approaches a cure? Yes, especially with peritoneal mesothelioma treated with cytoreductive surgery and HIPEC, and occasionally with early-stage pleural mesothelioma treated with multimodal therapy. Do treatments extend survival compared to no treatment? Absolutely. Do treatments improve quality of life by managing symptoms? Yes, in most cases they do. And are some patients living years longer with newer treatments like immunotherapy? Yes, they are. Here's what the data clearly shows. Treatment, it matters. Patients who receive appropriate treatment live longer and live better than patients who receive no treatment or inadequate treatment. Patients who are treated at specialized mesothelioma centers with experienced teams, they have better outcomes than patients treated at community hospitals by doctors without mesothelioma experience. The stage that a patient is at when they're first diagnosed, it also matters a lot. Patients who are diagnosed at stage 1 or 2 have significantly more treatment options and better outcomes than those diagnosed at stage 3 or 4. That's why early detection through attention to symptoms and proper testing is so critical. Patient factors matter too. Younger patients, they generally do better than older patients, and patients with epithelioid histology do better than those with sarcomatoid or biphasic types. Patients without other serious health conditions do better than those with heart disease, lung disease, or other comorbidities. And here's something important. Genetic factors are starting to play a role in treatment decisions. Patients with BAP1 mutations have been shown to survive significantly longer than patients without them. particularly when they're treated with platinum-based chemotherapy. As we learn more about the genetic basis of mesothelioma, we're getting better at matching specific treatments to specific patients. So, what does all this mean for someone who's just been diagnosed? It means you should absolutely pursue treatment. It means you should see specialists at a mesothelioma treatment center who have experience with this disease. And it means you should ask about all available options, including surgery, chemotherapy, immunotherapy, and clinical trials. And it means you should be realistic about goals while remaining hopeful about possibilities. The treatments that are available today are significantly better than what was available even 5 years ago. And research continues to bring new options. The keys to getting the greatest benefit from a mesothelioma treatment plan, it's being seen at a specialized center, catching the disease as early as possible, and having a physician who knows how to match your treatment to your specific situation and goals. If you've been diagnosed with mesothelioma and you need more information, visit mesothelioma.net. You can request our free information guide directly from the website or call Wayne at 1-800-692-8608 or use the live chat feature on the site to speak with one of our helpful patient advocates. As for me, remember to post your questions and comments below, and I'll see you next time.